teeth, and also to be able to guide or direct growth of the jaws. It can be the upper jaw, lower jaw, or both. And many people refer to it as orthodontics and dental facial orthopedics. And typically you can have a greater impact on the upper jaw, the maxilla, than the mandible. The mandible is a more independent growing entity. And as one fellow put it to me a long time ago, it's trying to keep the lower jaw from growing or get it to grow more. Trying to keep it from growing is like trying to keep a youngster growing taller. It's just more of an independent entity. You can do some things for the lower jaw that will help to make it look like you've helped the lower jaw to grow if somebody is retrognathic or their chin's back. What you're really doing is modifying some of the dentoalveolar structures. And dentoalveolar, what I mean by that is the bone surrounding the teeth. So you can make some changes to the lower jaw, but the lower jaw overall is more independent. The upper jaw, the maxilla, is much more highly influenced. Some people have an underdeveloped upper jaw. Some people have too much upper jaw growth and you want to slow it down. People who use, say, thumb habit, sucking their thumb, they accelerate the growth of the upper jaw. And sometimes they push the lower teeth back, and it's possible they could even inhibit the lower jaw growth a little bit, but you're really not going to affect the lower jaw as much as you are the upper jaw. So, it's not just movement of teeth. You take into consideration the skeletal structures that the teeth are mounted in, and we deal with all sorts of complicated situations, really, where people have multiple missing teeth, jaw growth problems combined with that, maybe impacted teeth, teeth that don't want to come in, and 90% of the time or more, you can make some huge improvement in the situation. Nothing is ever perfection. The only way you can have perfection is God's perfection. But we can make things where they're pretty nice, and many people are very happy with the overall change from initiation of treatment until completion of treatment. It's more than just moving teeth. It has to do with the skeletal structures also. And you just have to pick your timing. What's the right timing for each individual to have treatment? Most of the time, for full treatment, it's a 11 to 13 year range. Sometimes we have to do some earlier treatment. I'm just looking at some records of a little boy that's 8 and he has an underbite. Well, if you don't get in and try to correct that underbite, it's going to affect the growth of his upper jaw. It's going to inhibit it. So sometimes you get into some early treatment, but you don't do early treatment unless it really has a significant indication. It's really going to benefit that individual. A few crooked teeth, is not that big a deal. But if there's some other factors, you need to move teeth around, maybe they're real crowded, but you have to create room for the other teeth to come in, then it's warranted. It all has to be warranted. There has to be a good physical basis for that activity to occur, and you go through the expense and trouble of doing it.